Today, Massy Stores Providence collaborated with the Ministry of Health to host a community health affair. That's a one-day community health affair. Some of the services includes blood pressure testing, HIV, you could have donated blood, and so much more. What we're going to do, we're going to go inside of the tent and we're going to talk to some of the representatives, and you're going to learn much more. As we all know, health is very important. Let's go. We're still here at a Massy Health Fair in Providence. With me is Claire Clark. She's representing the Ministry of Health, the Department of Adolescent Health Unit, and she also have her colleague Leah. And it's a pleasure to have them on our feature. How are you guys doing?
We're doing great. It's been a good day so far. Hoping we have a lot of people to come in the afternoon, but so far it's been good.
All right, could you tell our viewers who are hearing about the Ministry of Health Adolescent Health Unit for the very first time, what are some of the services that you're offering here today?
Okay, sure. So today we're going to be looking at sexual reproductive health and rights. We're mainly focusing on family planning and contraceptives. It's going to be talking about the different types of contraceptives that are available in Guyana and also in general. We're also looking at drugs and alcohol and the effects of that on the human body.
And I see you had some flyers there with pregnancy, I think. And I also, what was interesting is that I see a male flyer there. Tell me a little bit about that, because ladies, you don't have to worry. But for the men, sometimes they tend to forget, think we forget them. So tell us a little bit about this flyer for men.
Okay, no problem. Well, men we haven't forgotten you. It's okay. We're happy you're around. So like you said, women, we know that there's a lot of services out there for women, but there's also, we tend to overlook sometimes. And again, men, they don't like to go to the hospital when stuff goes wrong. They wait until it gets to a point. But we are offering services to men. We're talking about men's general health. There's also a department of men's health that deal with that. So we have collaborative efforts with them. And the poster that you saw earlier is from the Department of Men's Health. So we try to make sure everybody's healthy. I know sometimes it seems like we're geared towards women, but we do appreciate and we do still want the men to be healthy. So we have those around.
I saw something there on the men's flyer with sperm count. You're doing sperm count as well too, because sometimes, men are a little bit more hold back than ladies, and then, they're in a relationship, the wife is not getting pregnant. They're scared to go to a private hospital because of what people might think of them. So let's talk a little on that.
Okay, sure. So we at the Adolescent Health Unit do not do the sperm count, but they can go to the men's health or they can go to their doctor, the office. The services are offered, and I know, again, men kind of feel like they need to be macho, but you don't. If there's something bothering you, you can go check it out, because at the end, we just want healthier persons, especially here in Guyana.
Okay. What has been the response this far from persons for this health fair?
So for this morning, there was not a lot of persons, but I get it. It's early Saturday morning, so I expected to pick up as the day goes. We have had a few persons, and the response generally when they come and they interact with us, it's good when somebody comes to the table and they go away learning something. And it's been really good when the persons that did come and they asked questions and we responded. They're like, oh, well, I didn't know that. And it's like, well, that's why we're here.
All right, and I see you have some tokens on the table. Tell us a little bit about that.
So we do have a few keychains. We have some bands, cups and mugs, rulers also, because not only do we do health fairs, and this is not the only topic we cover, we also cover health for adolescents in general. So that includes physical health, mental health, and we usually go into schools also. We have a lot of these tokens, and when we go out, we would do our sessions, and then we'd go like a bit of a pop quiz at the end. And when you answer the questions, you get to win one of the tokens.
Leah, we haven't forgot you, and Leah is wearing one of the beautiful bands here. Leah, how are you today?
I'm okay.
Would you like to say hi to our viewers?
Hi everyone. This,
All right, let's come back to where exactly is the Ministry of Health Adolescent Health Unit is located.
Sure. So we are located at Camp and Charlotte Street, where I know a lot of persons know it as the Citizens Bank. So I'll say where the old Citizens Bank is. The Ministry of Health has taken that building. It's now an annex for the Ministry of Health. So we are located on the corner of Camp and Charlotte Street. But if you want to get in touch with us, we also have a Facebook page that's at Adolescent Health Program. We also have an office number that's 223-5310. You can contact us there, and if you have an event and you want us to come out, we can. We set up a table and we do our thing.
Nice, thank you so much.
No problem.
Hi guys, we're still here at a Massy store health fair in Providence, and you know, health is very important. With me is two beautiful young ladies representing the Ministry of Health, and I'm going to be checking my pressure here today, which we have the lovely Dion is going to be checking my pressure, and also we have the lovely Nicola, and they're going to tell us a little bit more about the services that they're offering here today. So let's get right onto it and test my pressure. Oh wow. And I'm surprised that I haven't got a sign, because usually when my pressure is high, I would normally get a little sign that is high.
it don't always be for some people.
What do you suggest I do, seeming that it's a bit high? Should I stay out the sun? Should I go to the pharmacy and get medication? What do I do?
You could stay out from the sun, and you can also go to the pharmacy and get medication if you know the medication that you normally use for the pressure, and relax.
Right. And you know, when we said Ministry of Health, what exactly is this department here you and Miss Nicola is representing?
We're representing the MCH department, which is Maternal and Child Health Department.
Okay. So tell us a little bit about the services that you're offering here today, and not just today, but also at the department at the Ministry of Health.
At MCH, we offer the service of maternal and child health, which is prenatal and postnatal care for pregnant mothers and postnatal after delivery. We do monitoring of blood pressure, which we just check on you. We do vaccination, which we have today a variety of vaccine. We have available yellow fever, BT, HPV, and COVID booster, and the prime Pfizer.
Wow, that's a lot of vaccine, and I know yellow fever is very, very important as well to get, right?
Yes, yellow fever is important. All the vaccines are important. As we say, vaccine saves life, right? So I will advise people who are not vaccinated and immunized to come up today at Massy store here up to 3 o'clock and be vaccinated.
Okay. And for persons who would have missed today's event, I know the ministry would normally have other outreaches such as this, right? That they can
We're located, our office is based at Friendship on the East Bank. We have vaccines available at the Suicide Health Center on the East Bank, Supply Health Center, and Herstelling Health Center. Those are COVID we have, but all the other health centers, we have all the child health vaccine along with the adult vaccines available.
Okay. I want to come back to Dion. You mentioned that my blood pressure is high. For persons who's looking at this feature, what's the normal blood pressure range?
The normal range is 120 over 80.
120 over 80.
Yes.
Okay then. And it is important to check your pressure every day, every week. How often do you think persons should check their pressure? Because had I not checked my pressure, well then I wouldn't have known that my pressure is high.
Well, I would say it is good to check it every day.
Every day.
Yeah.
So you encourage persons to get one of this pressure machine if they don't have one at home, right?
Yeah, or they could go to the nearest health center and get it tested.
All right. Before we go, anything else you guys care to share with our viewers?
Just once you have your babies and children who are not vaccinated and immunized, you can take them to the nearest health center and let them be vaccinated or immunized. And remember, vaccine save lives, it works. So I will advise everybody to be vaccinated against various types of diseases, and so we have.
I have one important question before we go. The Ministry of Health is offering all these vaccines and boosters for persons who may not able to find their card, their vaccination, their COVID card, can they still come to the Ministry of Health and get their booster?
Yes, system is in place for that. What we normally do, we have the database system in place. So we locate your information, and based on that, we give you your available vaccines.
Thank you guys so much. Remember guys, health is very important. Get tested today, whether you're coming to do a booster, you need to check your blood pressure, and I urge you to get one of this machine in your home. I'm going to be talking with two beautiful young ladies. We have Denisa and we also have Denicia, that is, and Ashley, and they're representing the National AIDS Program Secretariat. You know, that's a very big department, and it's a pleasure to have them on our feature. First of all, I must ask, how are you guys doing today?
I'm doing fine.
You're doing fine. I see you're doing thick. How are you doing?
I'm doing great.
You're doing great. All right, you change your word there. All right, so let's talk a little bit about why is it important for persons to come and get HIV tested done?
Okay. The reason they should come and get an HIV test is to know their status. It's better for them to know, for you to know your status. You know, like the Guyanese term says, better to be safe than sorry. Right?
Now, Massy store is having this health fair, which the booth that you guys are having here is HIV testing. What has been the response this far from persons coming out?
We have a great turnout from both employees of the restaurant and Massy's employees, and also we had a few walk-ins from customer that is shopping in Massy.
What has been the age range for persons coming?
So far we have varies from 18 to 34 so far.
Okay. And for persons who would want to come and get HIV testing done, is there any sort of criteria or anything they need to go through before they come to this site to get that done?
No, there is no firm criteria. The test is free and confidential. You just go to any one of our testing sites. We have testing sites in all 10 administrative regions. Just go to any one of our testing sites and request for a test to be done.
Okay. All right. Could you tell our viewers a little bit about some of the testing sites for persons who may not know?
Okay, so we have about a quite few numbers of VCT testing sites in Georgetown. We have the National Care and Treatment site, the Dorothy Bailey Health Center. We have Camelville, KT, and we have some of the private sites too, not forgetting St. Joseph Mercy Hospital and Davis Memorial Hospital.
Persons who's coming and doing this testing, how long does the whole process take?
The process takes about 15 to 20 minutes to complete.
Persons who comes today here or any other one of the outreach that the Ministry of Health may have and is positive, how do you guys deal with that person there? Because that's not something that persons would want to hear. They will want to hear, you know, the good side, which that's considered a bad side, and they might feel that the world is ending there. What was the next step you guys do?
So what we do here, we do the pre-test and the post-test counseling. So we prepare them for whatever results that they will receive at the end. If they are positive, we talk to them, we give them a referral to go to at any one of our care and treatment sites where they're most comfortable with. Once they are in our care and treatment site, we follow the process and we take care of them. We make sure that they get counseling, they get medication, they see doctor at every visit, and from there we go on. And it's all up to the client if they would want to start treatment right away or if they prefer to do it in a later week or a later month, because our initiative right now is test and treat. Once we test you, you find out you're positive. The first thing we do, counsel you, make sure that you're in the right frame of mind before putting you on treatment.
And also you would encourage persons for the results that they get, if it's positive, that they should not have unprotected sex, right?
Yes, we encourage them to use a condom during sexual intercourse.
So they can still have sex while they're HIV, but must use a condom?
Yes, we encourage them to do so.
Okay. All right. Anything else you guys care to share with
Yes,
our viewers
and-
before we go?
Yes, and once they're on treatment also, we ask them to take good care of themselves, make sure that they're taking their medication how they're supposed to, how it's prescribed by the doctor every day. So when you're having unprotected sex, you need to have a low viral load. That is the number of virus you have in your body. So once you have a low viral load, it is less likely for the virus to be transmitted during sex, maybe the condom burst and so. So once you have a low viral load, it's less likely for the virus to be transmitted once you use a condom.
And you, anything else you care to share with our viewers before we go?
Come out and get tested. That's all I can say. Come out and get tested. It's better to know. Better.